Members, good morning. We have enough members to form a quorum. Please invite the administration and deputations to come in. Welcome government officials and also the consultants to the meeting. I'd like to welcome Ms. Annie Tam, Permanent Secretary, and Dr. Lo Chi Kwong, Principal Investigator of the consulting team, and Mr. Donald Cheng, Deputy Secretary for Labour and Welfare, Mr. Steve C., PAS for Labour and Welfare, Ms. Cecilia Lee, Assistant Director of Social Welfare, as well as Ms. Maria Lau, Assistant Director of Social Welfare. I'd also like to welcome all the deputations and individuals. So please seat according to your nameplate. We welcome deputations and individuals to the meeting. Some of you are already familiar with our procedures, but as a formality, may I remind you that Channel 0 is the floor. Channel 1 Cantonese, Channel 2 English, Channel 3 Putonghua. That's our broadcasting system. And when you speak, may I remind you that you will not be protected by the power LegCo Powers and Privileges Ordinance. In other words, you have to be liable for your own speech and remarks. Can I give the floor to the administration to give us some introduction? Ms. Tam. Thank you. I thank the panel for arranging this public hearing for us, and then on the 28th there will be another public hearing. I'd like to use a short PowerPoint presentation to give the background. Now, aging. As we all know, our population is aging. I'd like to tell you the real situation using this PowerPoint. By 2035, we will have 2 million of elders in the community. And for those who are over 75, the number will be double of our current amount by 2030. Those who are in between 75 to 75, we will have 50 to 520,000 instead of 210,000, and age between 80 and 84, 360,000 in 2030. For the current situation of residential care services in Hong Kong, the number of subvented homes, including the subvented and subsidized and bought places, with about 22,000 odd. For non-subsidized places, about 47,000 places. So in total, there are 73,000, but about 11,000 of them are not taken up yet. So we have about 62,000 places occupied. Among them, about 40,000 of them are provided by the private sector, providing both subsidized and non-subsidized places, and 20,000 of them are run by NGOs. They also include subsidized and non-subsidized places. Challenges we face is, of course, we provide about 22,000 places, subsidized places, and 3,300 care and detention homes places, and yet those on the waiting list about 25,000 and 6,000 respectively for different types of places, and the waiting time is about 33 months. In 2014-15 and 2017-18, we will have another 1,700 new places and also 500 non-subsidized places. In 11 projects, we're going to provide 1,200 new places, and in private developments on NGO sites, they expect that 7,000 places will be available. So these will arrive at 9,900. And our intention is to provide 3,000 LCS vouchers. The target is to ensure that elders and family members have the freedom to choose non-subsidized places, and there will be more choices offered than the current bought place scheme. In future, the government will first earmark those eligible places, and elders can choose places they prefer, and then vouchers will be given to these institutions. Now, the scheme will not be confined to private homes, because even in private homes there are non-subsidized and self-financing places. They can be covered in the pilot scheme. The pilot scheme will not affect current services. And also our plans to build new homes and to allow development in privately owned NGO places. What we want to do is to provide an additional choice using this pilot scheme, and it will be conducted very cautiously in phases. We will launch 3,000 vouchers in 3 years. The C has commissioned the Elderly Commission to conduct a feasibility study, and in July last year, we commissioned the Dr. Choi Wing-tak and Dr. Law Chi-kong from the Department of Social Work and Social Administration of Hong Kong U to conduct a study for us. Regarding our targets, in October 2014, we started the questionnaire survey, and November they interviewed those who are familiar with the services. And in January 2015, we briefed the Welfare Services Panel the preliminary findings and recommendations of the study. In February, we also did another questionnaire survey. We successfully polled 1,000 odd elders and family members waiting for subsidized places, and we also surveyed 246 LCS. We've also organized a range of public engagement exercise, and 246 elders took part in these events, and we received 6 submissions. On the way forward, next month, we're going to reveal the findings from the study and to be reported to the working group, which is under the EC. In May 2015, the consultant and working group will submit their final recommendations to the EC for consideration, and in mid this year, the EC will make a report to the administration. Thank you. Thank you. PS. Yes, can we have a hard copy of your PowerPoint, please? Yeah, for sure. We only completed it last night. Yes, the soft copy is available now. We have close to 60 deputations. So the hearing is split into 2 days. Today is the first session, and the second will be on the 28th of March. So can I give the chair to the Deputy Chairman, please? Thank you. First, from DAB, Ms. Zhang Fan Lam. Oh, yet to arrive. May I remind you that because of time constraint, each member can only speak for up to 3 minutes. Oh, so the second speaker is from Care Alliance for the Dementia, Ms. Zhang Yue Kam. Good morning. we have 3 points to make on the LCS voucher scheme. First, there are problems with the current services. We know that for patients of dementia, we don't know the speed of deterioration. We cannot predict how the disease progresses. Now, as family members, we want to take care of them ourselves, but we are concerned that the conditions may deteriorate and we can't take care of them anymore. So many families will apply for LCS places well beforehand. But sometimes when the place is allocated, the patient is still very well, and the family or the patient may not take up the place. But then when their condition deteriorates, they may not be able to have a place allocated again. We hope that the mechanism can take into account the actual situation of the patients, and there should also be a reserve scheme so that the patients will not lose their opportunity.
This is a way that can really cater for their needs. I think eligibility criteria can be made more lenient. If you talk about dementia, this doesn't only apply to the elders. There are patients who are under 60 years old and they cannot be taken care of at home. They cannot meet the minimum age eligibility, so there is no support in the community for them. What can they do? Number 2, concerning the service quality of the residential care homes, will the quality be enhanced with these vouchers? Can the service be attractive to people? Right now, the private homes and also the place purchase scheme are not welcomed by people. Even if a residential care home looks like a palace, it is only on the surface. We have to take care of the quality of service in these homes. So we hope that grade B1 homes can be upgraded to A1. Of course, the government can make use of the existing way to monitor the service, but has they taken into consideration professional training for the staff? Now, when the staff feeds the patients, they do it in big mouthfuls, and this is very dangerous because the food may choke the elders. So, I'm sorry, can I finish? And how can the family members rest assured? We recommend that there should be an independent task force with government officials, concerned groups, and different members of different sectors to monitor the environment of the residential care homes, to make sure that standard or quality of staff members can be enhanced. This task force must operate independently. It cannot be affected by the external environment, and there must be regular as well as surprise checks. Time is almost up. Can you please be brief? There must be a vetting or monitoring system for the quality of private homes so that there can be better monitoring and there will be more sustainable and good quality service provided. Sorry, thank you. Next, Mr. Fu Chunfu from Liberal Party Youth Committee. Thank you, Secretary, for giving us a lot of figures. In the past 5 years, on the waiting list every year, on average, there are 5,000 elders who pass away before they are allocated the places. Hong Kong is a wealthy society, so this figure is not acceptable. We welcome this residential care service voucher scheme, and all along we have been recommending this to the government. However, if you look at the numbers involved, there are 3,000 vouchers, but then there are 30-odd thousand elders on the waiting list. And based on the numbers on your PowerPoints, adding up all the figures, the total is still under 30,000. So I don't know whether you have taken into consideration natural wastage. For example, every year there are 5,000 people leaving the list. Now, residential care home or residential care service is not a profession that is welcomed by many people. So if we want to expedite the service, we have to build more homes or offer incentives for private organizations to set up these homes. Now, if you look at public housing and HOS estates on the lowest 1 to 2 floors, the space can be made available for private organizations to apply to set up residential care homes. And then there will be more places available. As regards manpower, in this particular sector, many carers are elders. No new entrants would like to join this industry. Yes, the government has a new youth service scheme, but then it will be too late when there are enough people who are available to serve the elders. So I think the import of external labor rules should be relaxed so that manpower shortage can be solved and then service quality can be improved. As in other advanced countries, Hong Kong faces an aging population. And up to 2014, there is 1 person in 3 who is an elder. So there must be a long-term and feasible plan. We hope the government can do a comprehensive review of the policy, review the policy data, lifespan, labor participation, and all other data to work out the short-term, long-term, and mid-term demand for residential care service, and then look at our service capacity. We have to put in place the relevant land and labor policy to make sure that there are enough resources to provide residential care service. Thank you. Next, Mr. Law Wai Kai of Hong Kong Elderly Service Society. Good morning, Chairman. I represent almost 400-odd private residential care homes. We agree to the government's proposal of the pilot scheme on residential care service voucher. However, some service organizations and groups on different occasions and on different media tend to criticize the service of private homes, saying that the service is very, the variance in the service quality is very big and then service quality is poor. But I don't agree. I would like to explain why there is a wide gap between government and private care homes. Now, in the private homes, people use the 5,000 to 7,000 CSSA payment to pay for the service fees. But then for the government homes, the amount of fee is 16,000 to 18,000. So by comparison, of course, service quality with only 5,000 to 7,000 fee is definitely much lower. But I think that the service quality is well based. With this service fee, I hope that all residential care homes can take part so that elderly people can have wider choice. Of course, there should be a categorization or a grading standard. There can be different service levels for different grades for the elders to choose so that the money will follow the people. And then the resources used by the government can upgrade the service quality overall speaking. Now for grade A1 care homes, only they are eligible to take part in the voucher scheme. Now for these homes, in terms of per capita area and also the manpower ratio, well, it's higher. There are professional nurses and physiotherapists. But then in these A1 grade care homes, the boss places account for 95%. For the remaining, there's already over 90% occupancy rate. So how can there be enough places for the elders to choose? As regards distribution of these homes, they are not evenly distributed in all districts. In some districts, there are no grade A1 homes for the elders. So how can they have enough choice? So we recommend that if the government is going to say that only A1 homes are eligible, we think that A2 should be upgraded to A1, or the scheme of board places should be expanded so that more organizations can join this class. And then in that case, there will be more good quality A1 care homes for the elders to choose from. Thank you. Next, Mr. Lee Wai from the Elderly Service Alliance. Thank you, Chairman. Good morning. Well, this voucher scheme has been discussed for a long time. Many people support the implementation of such a scheme as soon as possible. If you look at this proposal, I think there's consensus on many parts referring to different organizations' information. If you read the background brief provided by the LegCo Secretariat on page 2, feasibility study, point number 5, residential care service voucher, well, the service to be provided should be on par with subvented residential care homes. So this is the expectation of members of the public. We hope that the consultants team should take this as the principle to devise the scheme. Why is it that there are so many organizations saying that this won't work? For example, in Hong Kong, the Hong Kong Community Organization Society said that for subvented homes, the cost per capita is 18,000 or above. For board places, the cost is 10,000. And then the government would like to offer a voucher which is worth 11,000. Now today, there is a queue for 18,000, and then the government is going to organize another queue at 11,000. Now, who would which path would you choose? 18,000 versus 11,000. 33.4% of the elders are willing to queue up along the 11,000 line. So today, I think you can imagine the big demand, how big the demand is for residential care services by the elders. I think this plan should be implemented as soon as possible. There should be no further delay. 30,000 people on the queue, and every year 5,000 odd people pass away. Why do we have to wait 3 years to have 3,000 vouchers? What should the elders do? This is the main point. Besides, why do you want to categorize the elders in Hong Kong into 2 groups? Now, the care service may be the same, but then one group can enjoy this lower price of 11,000. Some people are already finding it difficult to afford 10,000, and then there is another level, 18,000. So how many categories do you want Hong Kong people to be divided into? Why is it that those who pay 18,000 can enjoy better service? This is the main point. Thank you, Chairman. Thank you. Next, Mr. Lam Lai Singh from the Alliance on Fighting for Subvented Residential Care Homes. Thank you, Chairman. I think the government doesn't face up to or can't face up to the elders if the elders have to wait further for the service. I think there must be a long-term welfare service plan. Enough and quality residential care services should be provided. And based on the content of the voucher scheme, the consultant team should conduct a few more consultation sessions. There should not be a hasty decision that this consultation is already enough. If you talk about the case management and the cooling off period, recognized organizations and the vouchers, we do have some points to make. Now, the SWD will serve as will refer cases, and then there will be designated people to deal with applications or make referral and do detailed promotion of the vouchers. I hope that after the cooling off period, if the elders become inactive cases, they can still maintain their places in the central waiting list. After the cooling off period, there must be the case service and there should be regular visits to the elders to understand the service quality that they are getting. The ceiling of the cooling off period should be 6 to 7 months. And the elders can make flexible decision to see whether they want to take part in the voucher scheme. After the cooling off period, they can still resume their position in the central waiting list. Right now, the monthly cost is 14,000 of residential care service provided by government. And in fact, based on the area, it's $11,685. And how will this gap be taken care of? I think the face value of the voucher should be enhanced to a reasonable level. For eligible service organizations, we think that the self-financing organizations and those qualified organizations should be the targets. This plan should not hastily cover all private residential homes. I think land rent also affects sustainability of the provision of service. Private homes face higher chance of closing down. We have to look at sustainability. So private homes should be covered by a one-off bought place scheme or voucher scheme. But then there are so many limitations in this proposal, and it is an uncertainty whether or not it can reach our expectations. So I think that the 800 million should be better utilized to improve service quality of these subvented homes. Perhaps a development fund should also be set up. I hope that the consultant team can be professional in their research, and the government should be people-oriented and conscientious. They should not just implement this voucher scheme in September hastily. Thank you.
Ms. Jim Munchan, Caretaker Concern Group. Oh, she's not yet here. Mr. Lee Chi-yong, the Association of Parents of the Severely Mentally Handicapped. Thank you. We would like to comment on the voucher scheme. First, we understand that the consultant team reports to the working group on long-term care model, which has three points in terms of reference to look at the housing, care, welfare, so on and so forth, and to provide a long-term financing scheme for RCS. It means that the administration intends to privatize our residential care services. We believe the voucher scheme should offer an additional choice instead of replacing government schemes. There should also be long-term, 10-year long-term plans for the needs of the PWDs and also the elders. There should be a white paper. Third, the government should provide residential care services. Before proper regulation, the responsibility should not be shifted to the private sector. For the bought place scheme and voucher scheme, the number of places should be subject to a cap. And for co-payment and also tests, about 34% of them supported the former and 15% only supported the latter. That means many of the respondents did not want means test. Therefore, there should be no mean testing, because without it we can do away with discrimination and more elders will be willing to take up the vouchers. And I must stress that public money should not be spent on subsidizing the development of the private market. Therefore, so long as they can complete a mechanism, elders should be given the choice whether they want to take up the vouchers or not. Second, there should be no co-payment. Fees and charges should be on a par with similar subsidized homes. Thirdly, we hope that the consultant team can uphold us professionalism, and do not allow the government to start the pilot scheme in September, even before there is a consensus in the community. Thank you. Mr. Jiang Kai-ping, concerned group for the interests of residents in Kwai Chong. Thank you. Because of our aging population, there is a greater demand for RCH places, and currently elders have to wait for at least 5 years. In Kwai Chong and Kwai Ting, we have the biggest population of elders aged between 70-something and 90-something. Some of them passed away even before they were allocated places. For singleton elders, while they are waiting for places, have nobody to take care of them. Some continue to live in their PRH places. They rely on civic-minded kaifongs to look after them from time to time. Hong Kong is such an affluent society, and the government claims that it would like to look after the elderly. However, services are very limited. Well, the government only pays lip service to the idea of caring for the elderly. Some academics and experts talk about launching this and that, and this so-called RCS voucher scheme is asking elders to buy places in the private homes. Will this resolve the problem? The only solution is to increase subvention to RCHs. Otherwise, the government will only be talking about a solution. Government officials are always shirking their responsibility to the market. So what can elders do? Because the government is so wealthy now, why doesn't it do it better? I strongly ask the administration not to shirk its responsibility anymore. You should recognize contribution by the elders in the past. Please respect them by taking care of them properly. You talk about a lack of consensus. In fact, there is already a consensus in society. For instance, universal retirement protection. This idea of the pool going bankrupt. If we have universal retirement protection, then elders can be fed better, and they will fall sick less frequently, so that perhaps they can really age in the community. So if you say no to this and that, what should be the solution? Now, if you think that this idea is not good enough, then you should think of another way. You should not ask elders to buy services in the market. So you must seriously consider this, because elders have worked so hard throughout their life, and I think they deserve a decent ending. Thank you. Ms. Florence Cheung from Labour Rights Commune. Good morning, members of the panel. Elders should age in dignity in the community, and I think we are quite fed up with the issue. some thinks that $80,000 is quite good in an RCHE, but this is not like going to the theater. If we place an elderly person in an RCHE, do you know what will be their final fate? Some elders are poor and are frail, and their adult children cannot look after them, so RCHEs is only the last resort. If you want a good elderly policy, then we must really have respect and care for the elders before we formulate any policy. Otherwise, any policy is bound to fail. Now, we don't really have a cure for bought place schemes, bought places, but as mentioned by many elders and past the debates in this council, the so-called grade A1 RCHEs have a lot of vacancies. Even in the community, we're aware of this. Some people are in dire need of RCHE, and yet there are still bought places not taken up. So what are the reasons? The government has not tried to find out the reason why is there this phenomenon, and yet they would like to have a community voucher scheme and RCHS voucher scheme. So how do they treat elders? Elders have labored for their whole life. Anyone is going to age, and do we have to treat elders in this way? Well, should we consider them disposable after they have contributed their whole life to society? Now, they talk about investment in society, and that education, medical and healthcare, elderly services is never considered investment, but an expense. And this is what you get after working for your whole life. And I think I am very angry. You call this a consensus. There is no consensus that the RCHE should be privatized. Unfortunately, in a debate, I said this to a doctor. If services in private homes are so varied, and there is not enough regulation, and yet you still want elders to stay in private homes, you call it additional choice. You are not doing that. And the answer I got was he understood this, but he didn't agree with me. I think you are doing it at the expense of elders. If we go on in this way, there is no hope for Hong Kong. RCHEs are not cinemas. They are only the last resort for elders. I hope that the consultant team and the administration heard what I said. Thank you. Ms. Ho Wai Kun, the Salvation Army Carer Association. Good morning. I'm the Vice Chairperson of the Salvation Army Carer Association, Ho Wai Kun. We have the following suggestions to the administration on the RCS voucher scheme. First, we encourage elders to age at home. This is always what the administration advocates. This RCS voucher scheme will encourage elders to move to RCHEs prematurely. The government should improve services in the community and encourage or support elders to age at home. Many families do not want to send their elders to RCHEs. They want to take care of them at home. However, expenses are very high when it comes to taking care of them at home, and many families have very high expenses. So some of us have no choice but to go for RCHEs for our elders, because the administration would want money to follow the person. Then you should consider giving a subsidy to elderly carers at home so that carers can choose to look after our elders at home and reduce reliance and demand for RCHE places. And you should also review the pilot scheme on providing living subsidy to elders in low-income families. You should expand that scheme to non-low-income families. There should be an allowance for carers at home. And because the voucher scheme is only for 3 years, you should treat it as a transitional arrangement. It should be used as a means to take care of elders while they are waiting for a permanent subsidized place. So their priority and waiting number on the list should be retained so that they can opt to return to the waiting list after the transition. After the 6-month cooling period, there should be a means of escape and allow applicants to go back to the central waiting list.
For example, the operators may change hands, and then there may be manpower problem, and service quality may worsen. And tenancy agreement may expire, or these homes can be relocated, and the service eligibility may be revoked. So we think that self-occupied properties should not be considered assets, and there must be a monitoring system. For example, on the plant website, there should be a discussion forum. Users can publicly comment on the service, for example, on whether or not there are additional fees or unreasonable fee items. There should be mystery guests to ensure that there is free flow of information and there can be reasonable monitoring. Thank you. Thank you. Next, Mr. Ng Wai-dong. Thank you, Chairman. I would like to make a few points. I won't repeat the points made in our submission. First of all, we are rather disappointed. Just now, Mr. Lee Chi-hong of the 7th Deputation said that there is not a long-term plan to meet the needs of elders for residential care service. Perhaps the consultant team can't answer this question. It should be this question should be answered by the Bureau. Every year a question is asked, and that is how many elders pass away while they are still on the waiting list for residential care service, and the government said 5,000. Without a long-term plan, in fact, there are not additional elders on the waiting list. But then that's not because of stagnant demand. It's just that, well, if you look at waiting time, in the urban areas, the waiting duration is 4 years instead of 3 years. So we are disappointed that there is not a long-term plan. Now, for RCHs, they are divided into 3 classes or 3 categories. For subsidized homes, the cost is around 14,000, but we have worked out the figure of 16,000 because subsidized homes, well, people have to, they have to pay $2,000 for accommodation, so altogether 16,000. For private care homes, those users are on CSSA for $5,000 to $7,000. And if you compare this to 16,000, well, this is a comparison of apple to orange. So the manpower is not really comparable. So the reality is that there are 3 tiers. On the first tier, on the upper tier, elders have to wait for 4 years, and then A1, $9,000 to $10,000. Still, there is a waiting list in this tier, but then things are not attractive because of the cost, and there are manpower problems. Tier 3, $5,000 to $7,000 in the consultant study. Well, this point is not really covered. If the consultant team wants to look into how to improve service quality, it seems that the voucher scheme only captures class A1. And okay, CSSA amount is only 5,000 to 7,000, so manpower ratio can't be improved. I don't know whether the question should be taken by the Bureau or the consultant team. Is the government really determined to improve service quality? I am not saying that private care homes are not doing a good job. It's just that the elder CSSA entitlement is too low. I think the CSSA payment or amount should be greatly raised for elders staying in RCHs. Now, if that's the case, then private homes will be willing to improve their service. If we only focus on A1 homes, well, I think the service quality of both private care homes and the other homes can also be enhanced. Right next to me is a carer of the elder. I think he can share his needs as well. Okay. Next, Ms. Choi To-chi. Good morning, Chairman. My name is Choi To-chi. Very soon I will be 8 years old. My husband is 82 years old. The two of us live on our own. He suffers from dementia and also cancer in his large intestines. Now, we take care of ourselves, but then I am very old. I suffer from many diseases. For instance, on the 6th of the month, I felt dizzy at home and I vomited. I felt very, very bad. But I didn't call the ambulance. Why? Because I have to take care of my husband. So can you imagine how difficult the situation is? With this voucher proposal, how much help is there to the elders like us? Okay, today I am here. I have to ask the elder, my neighbor, who is 84 years old, to take care of my 82-year-old husband. The government asks us to apply for residential care service in RCH. Now, my husband suffers from dementia and depression. And if you ask him to wait for 4 years for RCS, he is not willing. Not to mention the private homes. He is not willing to stay in public residential care homes. I am not willing to let him stay in these homes. I want to take care of him myself. So, government, have you taken into consideration the situation where elders take care of elders? Now, I am in bad health. I really feel very bad. I haven't received my medical examination result. If I have to be hospitalized, then what should I do? Is it really helpful to have this voucher scheme in place? If the waiting time is 5 years, if I start to queue up now, no one can tell what will happen in 5 years. No one can even tell what will happen in 1 year. So I think the funds should be allocated to government RCHs, and then couples can move into the same home. That will be a better arrangement. I hope that the government can consider this. You should consider the situation where one elder is taking care of 2 elders together. Thank you. Oh, the point that you mentioned is not included in the government's paper. So you talked about enabling a couple to be taken care of in the same home. Okay, so I think this point is not really mentioned in the government's paper. Okay, from DAB, Social Affairs Deputy Spokesperson Ms. Zhang Fanlan. Thank you, Chairman. In relation to RCS vouchers, basically, we agree to the concept. Concerning the waiting list for RCS, This matter has been discussed for a long time. Waiting time is very long. For high degree of care, the waiting time is almost 3 years, and there is no other solution. So we do agree that there should be a voucher that will follow the elders. If the vouchers follow the elders, then they can buy service with the voucher. For LCHs and service providers, well, they would like to strive for more customers. So naturally, they will enhance their service quality. And we hope that the service providers can become more competitive. And since everything will be market-oriented, service users will benefit and service quality will then improve. If service standard is higher, then we hope that some elders can be transferred to private homes in order to solve the problem of long waiting lists. And then they can get the service. They won't just wait and wait. As the old woman just said, she can't tell what will happen in 1 year, not to mention 3 years or above. If the voucher scheme can be implemented, and if there is higher service quality, I guess manpower requirement will also go up. In that case, I think you have to do more work in active training. Because now the position is not very attractive. There is not a good career path. So we hope that there can be more professionals like registered nurses and qualified carers to enhance service quality. Then their professional knowledge and caring skill can be better. There should also be an effective complaint mechanism. We don't want to see very serious cases that spread in society. We don't want to see elders being tortured or abused. Next, Mr. Chang Chi-ban from the New People's Party. Thank you, Chairman and members. Now, there is keen demand for residential care service. As such as now, there are 30,000 odd on the waiting list. Some people, actually 5,000 people, pass away every year without getting a place. Well, this is really saddening. For private, unsubsidized residential care homes, vacancy is up to 1/4. So there are a lot of demand that is unfilled. At the same time, there are places not filled yet also. So this voucher scheme is there to help elders who are willing to stay in unsubsidized residential care homes. The intention is good. Perhaps the urgent need of some elders can be met. However, we have reservations on the overall effectiveness. Why? Because if we look at the 1/4 places, why is it that they are not filled? I think the essence of the problem is that there is wide variance in the service quality in these private homes. Many people would rather wait instead of moving into these private homes. Now, space is very narrow and manpower is not adequate. Here are some figures for your reference. Subsidized homes, bought play scheme. Now, for subsidized homes, per 100 elders, there are 40 odd workers. In private homes, 10 only, so 40%. For carers, 16 to 8, less than half. Nurses, even worse. In subsidized homes, 5.1 nurses per 100 and 0.2 in private homes. What does this mean? In other words, in subsidized homes, one nurse takes care of 20 elders. In private homes, one nurse takes care of 500 elders. And there is only one nurse in a home very often, and she is already the head of the home. She has to deal with administration and other things, so she has not enough time to take care of the elders. So service quality is badly affected. If you are an elderly, which queues would you opt for? So with the voucher scheme, whether or not it will be successful depends very much on the service quality of the private care homes. I think the government must help the private homes to enhance their quality. We should not only look at Class A1, we should look at the overall sector. In terms of manpower, there should be more manpower, and there should be training for workers. I think there should be import of labor to solve or to alleviate manpower shortage. And I think the support services should be improved at root.
I don't think you have given us any submission. Now, if you do have a written submission, let us have it, because it's important. Ms. Alice Lee, the Alliance for the Concern of Carers at Home. We are against the implementation of the voucher scheme in September in haste, because the quality of bought places is questionable. The voucher scheme cannot address the genuine needs. Now, I'd like to ask you, if you know that you're going to stay in a private LCHE, will you be delighted? Under the LCS voucher scheme, CAT A1 LCHEs will be eligible. But many elders would rather stay in a subsidized home because, as we all know, bought place homes do not have quality assurance, as mentioned by a few speakers just now. The ratio of carers and professionals to elders is very low, so there is little support for the health of elders. Now, for subsidized homes, you have to wait for 33 months, and for bought places, you only have to wait for 17 months. You see that there is a greater demand for subsidized places than bought places, and according to a report, for those who are in the community, only 3.5% of them are willing to live in a private LCHE. The majority of them, that is 92.5% of them, would opt for a subsidized home. So the government should understand the genuine need of elders so that they can be given appropriate services. You should not just shift responsibility to the market by launching this voucher scheme. Rather than having a bought place voucher scheme, why don't you enhance support for community care? Our alliance always thinks that aging in the community should take priority over aging in an institution. We should use our resources properly. We should enhance the physical conditions of patients, of elders, and reduce the chance of dementia. And therefore, effective care is very important. Unfortunately, choices are limited, so elders have no choice but to go for LCHES. According to Census and Statistics in 2008, most elders did not prefer staying in an LCHE. They would like to age at home. The cost in an institution is $11,000 per month. That is equivalent to the cost of 2 to 3 carers. So this $800 million should be spent on paying carers in the community so the elders do not have to be institutionalized prematurely. Thank you. Ms. Joanna Lam from Hong Kong Social Security Society. Thank you. We've talked with elders, trying to understand their wish and needs. Many elders of the view that an RCHE is a last resort. That is, if they are very frail and in the community they're not given enough support, then they will reluctantly opt for RCHEs, rather reluctantly. Most elders want to age at home. They want to stay in their familiar neighborhood with the familiar neighborhood network. So aging in the community should be the basis, and aging in an RCHE is just a supporting measure. However, community care services are highly inadequate, so elders have no choice but to queue up for an RCHE place. In 2008, the Census and Statistics report said that even for frail elders, they would rather age in the community. However, we don't have enough community care services, and is it really the best choice for them by launching the LCS voucher scheme? The bought place scheme may cause elders to stay in elderly homes prematurely. In 2009, the Hong Kong U had a report, and it mentioned different types of community care services, and they were useful in preventing premature stay in RCHS. And in 2011, in a similar report, international experience told us that efficient and effective community care can delay the age of admission to an RCHE. It can improve the physical condition of patients and reduce the rate of mental deterioration. So the crux of the problem is insufficient community care services. It's good that the government is willing to spend $800 million on elderly services, but the money must be spent appropriately so that elders can really benefit, so that we can allow our elderly persons to age in the community. I'm Mr. Zito Shilfa from the Society for Active Elders. I am an elderly person living in Kwai Tsing. I am Zito Shilfa. I am 70-odd years old, living in Kwai Tsing West Estate for 28 years. In fact, my neighbors are very friendly. We support the LCS voucher scheme. When elders have to stay in an LCHE, we can choose the kind of homes we like to facilitate family members to visit us, to give us food, and for friends to visit us and to comfort us. We hope that the administration can be sympathetic to our needs and issue the vouchers ASAP. It's just like the medical voucher scheme. We really welcome it because it can, the vouchers can be used flexibly. There is no restriction on the district or community concerned. So long as clinic accepts medical voucher, we can consult a doctor there. And according to news reports, those who can afford it will pay more. Well, this sounds reasonable, but for general households, the burden is high because of inflation, and the median family income set by the administration is on the high side. So from if you earn $23,000 per household, then you have to pay $8,000. If you earn about $11,500 per month, you have to pay $4,400. Well, the family income is so low. Do you think it can really support a family? Our adult children have a heavy burden, and elders are worried if they're worried under co-payment. So please provide more choices for us and consider the wish of elders. Thank you. Mr. Lam Hon Wai. Mr. Lam. Thank you. Good morning, Chairman. As we all know, our population is aging. There is a greater and greater demand for elderly services. I agree with the administration in providing more resources for elderly services. However, I am not going to support the voucher scheme because the government talks about aging in the community. And I think this scheme runs counter to the government's proclaimed policy. Since the government is wealthy now, we should increase resources for community care services. And there should also be a comprehensive plan for elderly services. And we must have a consensus before we move. As a social worker, after following view, the government has launched many pilot schemes. Social workers have a very heavy workload, and this may be the last straw. So every time there is a new pilot scheme, social workers have to fill the gap. So the government should have a more comprehensive blueprint to map out the way forward, and there should be better case management to ensure better services for elders. Point 3. Now this is a voucher scheme. I don't quite understand the objective of the voucher scheme. If it is some money follows the person, then previously there's the community care voucher scheme. So shouldn't we wait for a review of the community voucher scheme first before we have a new one? Now, if the voucher scheme here is meant to shorten the waiting time, will it be effective? And fourthly, what are the targets, the beneficiaries under the scheme? If you look at the details of the voucher scheme, does it want to attract elders who have just joined the waiting list, or for elders who have an acute need for services? And are you going to attract elders who would like to have co-payment with the administration? We're not too sure about the objective of the scheme. Thank you. Ms. Poon Tip Mui. Thank you, Chairman. I'm against the voucher scheme. Why? Because it is launched so hastily. There already are 2 pilot schemes available. You have 2 pilot schemes in progress, and very soon, even before there is a review of the other pilot schemes, you are launching a new one, as said by Mr. Lam. Will the voucher scheme continue after 3 years? Will there be changes? What will happen to elders who have already taken up the vouchers? As Lee Feng-King said, money should be spent in a proper manner. Thank you. Ms. Wong Yuk Ting. Thank you. I don't think this scheme will help elders who are taken care of by their families, because 3 years afterwards they may have to join the queue again. Isn't it a bit troublesome for family members? And only those who are on CSSA can apply. For those who are not on CSSA, they have to go through a means test. This is troublesome. I don't agree with the scheme. Thank you. Ms. Choi, you know? Good morning, Chairman. Good morning, members. I am an elder. Well, this 3-year LCS voucher scheme, what will happen after 3 years' time? Will I continue to receive the service? Thank you. Thank you. Representative from Cheung Kwan O Concern Group for Livelihood, Ms. Mac Yuen Lin. I am Mac Yuen Lin. I represent the Cheung Kwan O Livelihood Concern Group. The government's elderly policy is one of aging in the community as the basis with support from RCGs. This is a good idea. Most elders would prefer to age at home unless they are so frail that they cannot take care of themselves at home. There are many reasons why elders prefer to stay at home. Now we can do our own cooking, we can see friends and relatives, we can reminisce over our various familiar things at home, and we can join activities of elderly centers. We can have a very lively life at home.
Okay. However, aging at home is still risky or dangerous. When we climb to a high level to do cleaning, we may fall down, and then we are not able to move the large appliances to do cleaning. If we do it with a lot of force, we may harm ourselves. But then if we don't clean the place, then there may be the breeding of mosquitoes and cockroaches, and the environment will deteriorate. As a result, we will suffer from diseases. Now, we have to wait for like 10 years for home cleaning service and half a year for meal delivery service. Some elders have their bodies injured because they fall down. So in that case, well, the government will have to spend a lot of money to cure the elders. The elders also have to suffer from a lot of pain. We don't want to become so injured or frail. So we hope that the government can allocate the 800 million to, for example, cleaning service, meal delivery, and escort service to the clinics and hospitals and so on, so that they can be aging at home. And the unnecessary threats can be eliminated. The elders will feel very comfortable to age at home. We don't need to wait on the long queue for RCS. Only, the places will be made available for those really vulnerable and frail elders. Next, Mr. Kwong Wing Tai. Thank you, Chairman. Good morning. My name is Kwong Wing Tai. Today, I would like to make comments on the RCS voucher scheme. There are a lot of controversies. Now, there are so many private homes with varying service. And how can we differentiate the A1 grade homes? And we are talking about commercial behaviors that are really varied. If you ask the elders to find service themselves with their vouchers, well, there are a lot of risks involved. There is the need for common payment, and there are 8 tiers of fees. This is really confusing. The reason for implementing the pilot scheme ASAP is that there are still 20 to 30% vacancy in the grade A1 care homes. So the vouchers are used to serve as incentives for the middle class to use the service. So I think it's like dumping the public funds into the drain, because the amount of money can help 6.5 IH common case elders. How did I derive this figure? The highest cost of A1 grade home is 16,600 odd. But then for the category I mentioned, the cost is 1,700. Now, one bought place is equal to 6 IH normal cases. 3,000 bought places times 6. Well, that means that we can immediately solve the 18,000 cases waiting for IH service. So if this is the way to use the 800 million is more meaningful, more elders can benefit. And this is also in line with the principle of aging at home and RCHs being the support. Thank you. Next, Mr. Chang Wing-chan. Good morning, Chairman. I am an elder in Chang Kwan-o in Sa Kung District. My name is Chang Wing-chan. Concerning the RCS voucher pilot scheme, I think government officials have a good intention because you would like to offer service to the grassroots elders so that they can age in a secure way. I think the intention is good. However, we are talking about the poorest people, and most of them are elders. Now, if the government can offer quarters to all these elders, then that will be very good. Now, we are talking about the grassroots people, but then I think this proposal is not fair to them. The government's attitude is not responsible. Everybody has contributed to the prosperity of Hong Kong, and those elders have worked on the front line. Now they are old. I think the government should take full care of them. If you pass the responsibility to the market, this is not right. There are only very few residential care homes that are well run. Those care homes that are run by some associations organized by people from the same village or same province are better run. But then in many cases, one carer takes care of 20 to 30 old elders. And I think this is not worth the over $10,000 fee. So that's why many elders don't want to move to the RCH. They would rather get community or home care. So I hope that home care service can be enhanced to improve the situation. Many elders are not willing to move into residential care homes. First of all, they have to pay. Secondly, the care standard is not good. When elders first move into a residential care home, they are strangers to each other. But then if they can age at home, at least they know their neighbors for more than a decade. I think it's better for the government to enhance or reinforce the service. Okay, thank you. Thank you very much, Deputations, for your comments. We still have 30-odd minutes. So now I would like the Secretary and the Deputations to make some simple responses. Just now, there is a point about worrying on the service quality of private care homes, whether or not there is enough manpower and the service fees. I think we welcome the $800 million investment of the government, but should the money be given to the residential care homes or the community in the future? Will this voucher scheme replace the subsidized residential care service? And then there is a representative representing the seriously disabled. If a severely disabled person is also an elder, or if he is still young, but then his physical function is no better than an elder, then have these people been well taken care of? Okay, I think I will give you 5 minutes. Just now I have already given a brief introduction, so I will invite Dr. Law to explain. We will split up the 5 minutes. Okay, thank you, Dr. Law. Thank you, Chairman. We have heard the deputations. Next month, we hope that we will pass all the views that we have gathered to the working group under the Elderly Commission. I think the consensus is very clear. Aging at home is definitely a policy. In other areas of study, we have given our views to the government. Many people are on the queue, and some have passed away before they are allocated places. Of course, planning work has to be done, but we also have to help those people on the line. This study has told us that elders who are on the waiting list, well, more than half of them say that they don't need to be given places in residential care homes right away. Most of them would like to stay at home. Those who are staying in private residential care homes, 1/3 of them said that they don't want to be relocated, or they don't want to move to another residential care homes. So the elders' preference is very important. When it comes to this voucher scheme, there are a few objectives, as mentioned by the deputations. Then choice is an important factor of consideration. Some deputations mentioned case management work. Some time ago, in some consultation sessions, some service or some social workers asked whether there will be designated teams to handle case management. Well, later we will relay these views to the government. Well, concerning elderly policy, we do agree to points mentioned by the deputations. Of course, we hope that the elders will be healthy, they can enjoy their old age life, and we do understand that elders like to age at home. This is their preference, and we will try to meet their need in this regard. But then for the frail elders, they do have their special needs. On the waiting list, there are really elders waiting, so it is not possible for us not to offer the service. Here we're talking about this pilot scheme on RCS vouchers. It doesn't mean that we won't work on aging in community or aging at home. We will still try to solve problems related to aging at home. We do understand the importance of a long-term plan. The consultant team is helping the Elderly Commission to work on a 2-year elderly service plan. So we attach importance to points mentioned by deputations. Talking about aging at home and residential care service being the support, well, as I said just now, there are both subsidized and non-subsidized care homes. For subsidized homes, there is a long waiting list. We have been working hard. For example, we consider the NGO's land. We have earmarked 11 sites. We will, well, from now till 2017-18, 1,700 subsidized places will be provided. So the total will be 10,000. We are working very hard. We do understand that we should earmark space on appropriate size to work on aging at home and RCS. However, you have to understand that it takes time to build the facilities. The problems that we are facing are that there are 30,000 elders living in private residential care homes. Some of them are on the waiting list and are on CSSA. Can we enhance the service in these homes? As regards the traditional board play scheme, can there be more choice for the elders and their family members? We hope that this choice can also help enhance the service quality of the private homes. When it comes to subsidy, there are different circumstances, but we hope that the vouchers can help enhance the service quality to grade A1, then that will be an improvement. The consultant team said that we had put in a lot of effort in the design in relation to transparency, case management and future monitoring, and also quality management. We will be doing a lot. The consultant team will also give their views to the Elderly Commission. Thank you, Permanent Secretary. Now, it's time for members to speak. Tang Ka-piu, Leung Yu-chong, Fernando Zhang have indicated their interest to speak. Are there other colleagues who would like to speak? If not, then 5 minutes for each member.
Mr. Tang Ka-piu, thank you. From people who are from subsidized homes or those who care for the development of our sick cheese, they will ask you the average waiting time for Grey Cat 1A bought place is about 7 months or not or so. So it's really necessary to have an RCHS voucher scheme. If I don't mind bought places, why should there be a voucher scheme? I think this is the first, a big question. And secondly, some organizations are working very hard to improve community care services. Of course, there is currently a voucher scheme for that, $5,000. But for our CS voucher scheme is $11,000. So perhaps elders may be attracted to take up the RCS voucher scheme instead. So if I may be bold, can we add this $11,000 to the community care voucher scheme as well, so that no matter whether you opt for community care or residential care, you still get $11,000. Secondly, I am shocked to hear that there are 11,000 vacancies in private homes. Now, if we spend all this money on the voucher scheme, how can you ensure that service quality of these 11,000 places can be enhanced? Can you give us information on the space per person and also the manpower ratio? So for the 11,000 places, how many of them are just at the minimum level and some are already at Cat 2 level? You have to give us such details. Can you give us information on this before the 28th or before this September? And on average, elders are receiving $7,000 in CSSA per month. I think this is just the average. Some may be receiving more, some receiving less. Can you give us a breakdown so that we can understand the range, so that we know how difficult it is? I agree with SOCO's views, so please give us supplementary information. And the most important question is, will you consider providing $11,000 per person, and the elder can choose to use it on community care or residential care? Thank you. Mr. Tang has 2 questions in the main. Why for EA1 the waiting time is 7 months only? Why do we want to launch a voucher scheme? Now, for the traditional bought place scheme, the government first chooses eligible bought places. Elders cannot choose places they prefer. So under the voucher scheme, money follows the person. We have taken experience from our Guangdong scheme. We let elders know what homes are eligible, and elders can choose the RCS they prefer. And then the voucher will be issued to that RCS if it is chosen by an elder. And for service providers, in order to enhance their business, they will have greater incentive to improve their quality of service. Because if they're not chosen by elders, even if they are considered eligible by us, they will not be given any money. We do know that it's important to have our community or to age at home. Of course, it's best for elders to stay at home first before they live in RCHE. We have a community care voucher scheme, but I think Mr. Tan will understand that the services and resources are required by an elder in an RCHE will be very different if he were in the community, and therefore the level of the voucher value cannot be the same. But I'm just worried that this new voucher scheme will offset your community care voucher scheme, and for a singleton elderly who's suffering from dementia, he won't know what to choose for himself. Now, for those who cannot choose for themselves, we hope that they will have family members. And if we can explain to let them understand, I hope that they can make their own choice. If they can't, we will not force them to choose. We will not impose any RCHE on them. Mr. Yu Chung, we are of the view that the voucher scheme is pushed too hastily, and stakeholders feel that they don't have the opportunity to comment on the scheme. So the question to the administration and the consultant teams is whether another in-depth public consultation will be consulted. And there are deputations who want the scheme to be implemented ASAP. I think there is conflict of interest here. As we all know, some elders may live in very poor conditions, and they may have conflicts with family members. Only under such circumstances will they want to stay in RCHEs. For the majority of elders, they rather stay at home. I think those who live at home have a greater demand for care, and this scheme fails to address their needs. There will only be 3,000 vouchers. So if the elders involved can live long, then we can at most help 3,000 elders under the scheme, or at most 9,000 if they don't live long enough. I don't know why you want to try out the scheme for 3 years. I think 1 year is enough, and at most 2 years. It would be a waste of resources. So can you shorten the pilot scheme, and part of the resources is spent on community care instead? I think that will even be better, because as said by the deputations, some elders have unfortunately passed away at home with nobody knowing it, and their bodies will only be found out after their homes became stinky. This frequently happens in PRH estates. So I think we should improve community care services instead of having meals delivered on alternate days. Perhaps it should be done every day, and we may be able to prolong the life of elders living on their own in the community. And if the homes can be cleaned better, then elders may also live longer. $800 million is earmarked for this voucher scheme. Is it really ideal or desirable? Perhaps some money can be channeled to home care, so 2 schemes can run in parallel. P.S. Let me stress once again that we do want elders to age at home and in the community. The voucher scheme doesn't mean that resources would only be spent on RCS and not on home care and community care. However, we cannot ignore the demand for RCS. Mr. Leung talked about aging in the community and at home. Yes, we will improve services for that, but the fact is many elders have a need for RCS and they're on the waiting list, and the waiting time is far from desirable. So we have been identifying sites to provide new places, and we will have about 10,000 new places. Well, you've been repeating yourself too many times. Can you do away with such repetitions? No, I'm not doing that. Now, if some of this $800 million is channeled to community and home care instead, then it will not be fair. No, I'm not talk about that. Well, the first year, you will help 3,000 elders. I'm not asking you to reduce the quota. I'm just asking you to shorten the trial period. No. I just you asked whether we can shorten the pilot scheme. Can we launch 3,000 in one go instead of in 3 years? Now we have to do it slowly and promote the scheme slowly to elders to make them accept the scheme. I think this is an excuse for a pilot scheme. What difference does it make whether it should be 3 years or 1 year? Can I go on because my time is up? No. You still have time. I want to explain. This pilot scheme is a brand new scheme. How brand new it is. I'm furious. How innovative the scheme is. Well, this format is rather new. Well, I cannot put up with this. You call that innovative. I feel so angry. How new, how innovative the scheme is. Allow me to explain. Please allow the PS to answer. Well, it doesn't matter if Mr. Leung doesn't agree with my adjectives. Well, I can use facts to explain. Traditionally, under a bought place scheme, we buy places from eligible homes, and when they admit elders, we whether the places are taken up by elders or not, we still have to pay the homes. But under this voucher scheme, we tell elders that places are available in these eligible homes and will only pay these homes after the places are taken up. No, I'm asking you to shorten the pilot scheme so that the money can be spent for other purposes, and yet you are evading the question. You're forcing me to oppose your scheme. Dr. Fernando Zhang. Thank you, Chairman. I apologize for being late because I didn't feel well this morning. All right, $800 million will be spent on improving LCS. It is a good idea. No matter how we see it, the government's move should be supported. Although just next door, they're talking about that $140 billion on the third runway system. So the government is willing to invest heavily in infrastructure and not on livelihood issues. Right, the government's idea is to allow elders to age at home, so we should avoid institutionalization as possible. We should avoid putting elders in RCGs. I think we are placing far more resources in RCS than community care services. All right, there is a community care service voucher scheme, and another voucher scheme will be launched. This RCS voucher scheme will give an elder $11,000. With this money, you can choose a Cat A1 home although as set by Mr. Tan Ka-biu, the average waiting time for an A1 place is about 6-7 months. After you have opted for this, you will be taken care of around the clock. But for community care, you only get part-time help. Even if you get $5,800, you can only receive 3 days of service. You have to top up, or you may have to top it up to $2,000, and still you will still be in the community and be on your own for 4 days. So you need to find someone to look after the elder in these 4 days. However, if you've opted for a voucher here, you can just place an elder in a home, and you don't have to worry about the elder anymore. Now, I am looking at the issue from the perspective of treatment or disposal of an elder under the 2 different schemes. Of course, the 2 schemes cannot be accepted together. So for a family, I think they will be more inclined to choose LCS. This is not the wish of the elder himself, but rather the wish of family members or carers.
When it comes to top up and additional resources, well, there may be not so much, but then at least the matter is dealt with. We are not talking about dealing with matters because we are talking about human beings and lives. So we should offer better living condition and environment to the elders. Well, they are already very weak and frail. With this scheme, will more people opt for residential care homes or community, aging in community? I guess the former. Many elders and their family members may not find it easy to make a decision. In many countries, they will adopt a case management approach. So there is a case manager, and he will play a role as an advocate to decide for the elders as to what is meant by the best interest. And this case management approach cannot be adhered to the service providers. So it is only to break down the boundary among various social welfare organizations. But then this case manager is adhered to the residential care home. And the community manager is also part of the service provider. So there is conflict of interest, really. And if you look at the service delivery model, this is a big drawback. Or this is a very big pitfall. Now, I understand that it seems that your policy will encourage people to stay in the residential care homes. Now, Chairman, I guess the proposal is going to be counter-effective. So I would like to explain more clearly the problems that we have identified. Can you make a brief response within 1 minute? Thank you, Dr. Cheung, for your very detailed analysis. It is very helpful to me. Aging at home is the elders and their family members' preference or wish. This is very clear. If we want to offer help to both sides, and if the focus should be on aging and community, family members would like to take care of their elders. And of course, we will offer a lot of support services to the elders. The fact is, around 6,000 elders are on our central waiting list, and they are on CSSA, and they are now staying in private residential care homes. So if there is this voucher scheme, if the 6,000 elders opt for the vouchers, we will offer more resources and they will enjoy more help because they are already in the private homes. It's not that they are now at home and we encourage them to move to the residential care homes. Now, we have to implement both pilot schemes together. We will have to assess the situation to see whether there will be the issue of reduced demand. As regards case management, we have also realized this possibility of conflict of interest, and the workers' workload is very heavy. If they are to take up case management work, well, I think the choice available to the elders and their family members must be such that their needs can be met. We will discuss with the Elderly Commission and the consultant team as appropriate, and we will take into consideration your comments. Second round, Mr. Tan Ka-pyo. 3 minutes, please. Based on our discussion just now, there are 11,000 vacant places in private care homes. And you just pointed out clearly that those elders on the central waiting list, well, there are 5,800 elders who are in private care homes and on CSSA. For the vouchers, well, these vouchers are for the 5,800 elders, and then they can buy better service with the vouchers. That's what I have heard. Now, okay, how can you make sure that with additional resources, the private residential care homes can offer better service to attract them to opt for these private care homes? With the new scheme, well, I haven't been able to understand the causal relationship. Those who are on waiting list and are in private care homes, you said that more resources can be given for them to buy better services. Is it really true that there are a lot of better services available? I do doubt this point. Those who are in private care homes, well, many of them are living alone. There is only little support from their family members. They are still at home. Just now I asked a follow-up question. So how much choice is there really there? They don't have any family members to take care of them, so they are forced to live in private care homes. And how competent are they to make a choice? Some elders are on waiting lists, and they are being taken care of in residential care homes with enhanced service. And 60% of the residential care homes don't accept the enhanced service. So if there can be community care, then the residential care homes pressure can be alleviated. Now, some elders are already living in private care homes and they are on the waiting list. There won't be support for them. So how can you convince me that they will be capable of making a choice? Permanent Secretary, half a minute. We have been emphasizing that we are not trying to replace aging at home by residential care service. We agree with Mr. Tang that if aging at home is done in a good way, then we are willing to do more in this area in order to reduce the need for residential care service. However, some elderly really need RCS. So if they need RCS for the subsidized homes, we will increase the number of places and we will increase the number of self-financing places. If everything goes smoothly in the future, there may be 1,000 such places being planned. At the same time, we have to understand that in the private market, if the quality of these places can be enhanced, well, there are elders who are now already living in private residential care homes. And if we are able to provide the service vouchers, well, we are willing to try. So that's why there is this pilot scheme. How can we make sure that the service quality will be higher with additional resources? That is one of our concerns. So that's why we asked the Elderly Commission to think of the design. We want to enhance the degree of transparency and case management quality. okay, if the private homes take part in the board play scheme, there is a plan on manpower ratio and area per capita. However, these elders are given vouchers, but then if private care homes only start to enhance service at that time, how can this be possible? Now, if the problem can't be solved today, we still have the meeting on the 28th. Mr. Leung Yiu-chung, Chairman, at first I was opposed to the scheme. And, well, perhaps we can try it on 1 year instead of 3 years. But then you didn't elaborate on this point. You just said that there is the need. I can't see where the need is. Okay, we're only talking about a 3-year pilot scheme. And after the pilot scheme, you will do a review. And the review won't be completed within a month. It will take at least half a year. And then that will be 4 years. After 4 years, what will you do? Even if you are successful, okay, you said that this is a very innovative scheme. Then after 4 years, then what? How many 4 years do elders have? I don't think this is a good way. So I suggested a dual approach. You have so much money. I won't comment on whether the scheme is good, because if you want to implement it, you will do it. So perhaps you can allocate some resources to aging at home so that more elders can benefit, and the demand for RCS can be reduced. So why can't you adopt a parallel approach? Can you give a specific answer to this point? And many elders and organizations said that consultation was not enough this time. They don't have enough chance to express their views. There is no district-based consultation. Will you conduct district-based consultations? Permanent Secretary, I would like to emphasize repeatedly that we will still emphasize aging at home. We do agree with Mr. Leung. If aging at home is done properly, demand for RCS will be smaller. So we will be very active in that. Chairman, she is repeating herself again. I'm asking whether 3 years can be changed into 1 year. Please don't waste time. Yes, I am going to answer you now. We are proposing the scheme, so it will be in 3 phases in 3 years. Of course, it depends on the consultant and the elderly commission to see whether they would like more phases. This is a new scheme. The elders and the service providers need time to adapt to this scheme, and some operators need to enhance their service. The elders and their family members have to have time to consider how they should make their choice. So we think that 3 years is not a long period. We respect Mr. Leung. Perhaps a shorter pilot scheme may also work, according to Mr. Leung, but then 3 years is not a long period. The consultants will make a report to the Elderly Commission for them to decide. So I will relay your points to the Elderly Commission. Can you offer a very objective justification on 3 years? And why can't it be 1 year, Chairman? Okay, you can come back. They will come back on the 28th. Dr. Fernando Zhang. Thank you, Chairman. Another direction I would like to explore is, can the $800 million facilitate a reform in the private RCS market? If we inject 800 million and then in the private market, the inferior ones can be phased out and only the better ones are left behind, then we are giving the elders more choice. And in terms of cost and other areas of consideration, I think you will still focus on the private organizations. You will still continue to have the subvented organizations. Okay, for the 3,000 vouchers, can we have the phasing out of the inferior ones, and can the better ones replace the inferior ones? When it comes to A1 and A2 facilities, some private organizations said that they would agree to A2 but not A1. The difference between A1 and A2 may not be big. However, now in the number 63 report, it is stated clearly that for A2, it's 8.3 square meters and A1 9.9 square meters per user. But then comparing with the contract residential care homes, 20.8 and then 17.5 for subsidized care homes. So that is 2 times. So when we invest money, okay, let's say if a care home used to be A2, they want to become A1, they have to reduce the number of places, and still they are no match of subvented residential care homes by 100%. When the elders see that the subsidized homes are better than the A1 homes, well, we are only talking about area. If we also consider nurses, then perhaps the difference is more than 100%. So am I going to give up my private places? I don't think so. Well, for the people living in private care homes, can they switch to A1 residential care homes? Now, in the future, I'm sure that there is going to be a tension. Of course, the private residential care homes don't want the elders to leave, and so they will have the incentive to improve, but then they won't become very good all of a sudden. The elders don't want to move, so eventually, with 800 million, can we really pull up many A2 or lower care homes to become A1? I have doubts. At the end of the day, I am worried that the money won't be well spent. The money will only go to the private residential care homes, and we won't see a lot of effects in improving service quality.
Just expression of his opinion. All right, one sentence from you, Mr. Yu Zhong. My question on consultation was not answered. Well, as I said in my PowerPoint presentation, we have consulted some stakeholders and received some submissions. Perhaps Dr. Law can tell you something about our consultation, and Mr. Leung will see whether it is comprehensive enough. Yes, we received many views. Well, all of the views expressed today have been heard by myself in the past, including the views from Mr. Leung. Now, even if I extend the consultation period for another 2 months, the views will be very much the same. I think even for views expressed this morning, they are controversial on contradictory in some ways. In my final report to the Elderly Commission, I'm sure I won't be able to satisfy everyone 100%. It is impossible for me to satisfy the demand of both sides in my report. This Saturday, I will be most happy to continue to listen to views from deputations. If there are many fresh ideas we've not heard before, I don't rule out the possibility of extending the public consultation. But judging from what I've heard this morning, I won't recommend for an extension to the Elderly Commission. Okay, it's about time we end the meeting, so I'll do some summary. Yes, I agree that some of the views expressed today are contradictory, but quite a large proportion of deputations believe that the voucher scheme should not be launched so hastily. Secondly, some deputations asked about the conflict between community care and residential care. And given that the Community Care Service Voucher Scheme has not yet been reviewed, should we launch another voucher scheme so hastily? There are views that perhaps the vouchers can be effective in raising quality, and yet we don't have a lot of data from the administration yet. So on the 28th, we expect to have more information from the administration. The question asked by Mr. Tang Ka-biu, the distribution of the vacant bought places, and secondly, from Dr. Fernando Cheung, whether after upgrading their service, can B2 places be on a par with A1 places and even subsidized places? And can the report be delivered to the EC and this council simultaneously? And secondly, can the EC inform this council of its preliminary views on the report? And third, I hope that the chairman or representative of the EC can attend our public hearing on the 28th of March. I hope that the chairman or someone from the EC can be present to let us know their views. Although I understand that the consultant would give a report to the EC. So this is a summary of this morning's discussion. I don't really expect any reply. This Saturday, we will have the last hearing on the LCS vouchers scheme, and I want more some comprehensive responses from the administration. Right, regarding the papers you just asked for, I'll see how we can do it. And then the request for the EC chairman or a representative to be here, I will relay your wish to them. But how EC deals with the report and consultation of the council, I have to seek the views of the EC first. Okay, thank you very much. I declare the meeting closed. Thank you very much.